On this day, a young black mother by the name Henrietta Lacks rushed into the gynecology clinic of Johns Hopkins Hospital complaining about a knot on her womb.
Oh my god, I have a knot on my womb!
Days after examining her discomfort, the woman's biopsy results concluded she had cervical cancer. Since the diagnosis, doctors at Hopkins have done everything they can to get rid of the malignant tumors growing on her cervix. Lacks received radium treatment, which meant that she had to have tubes of radium inserted into her cervix, and this in fact worked for a while. The tumors nearly vanished and all was good for a few months. However, the progress soon depleted and her condition became worse. Her hospital visits became more and more frequent. However, doctors would still send her home.
Can you please help me?
Until one day, when the pain became unbearable, she demanded to stay.
No, no, no!
Fine, can we get her a room?
But by then it was already too late. The tumors overspread throughout Henrietta's body, and she would then pass away on October 4th, 1951.
In the arms of the angel.
What led to Henrietta Lacks' death, obviously other than the cancer, has been speculated for many years. And one topic that has been prominent in the debate involves racism and segregation in medical care. The hospital in which Henrietta received her treatment did in fact separate colored patients from white patients, even having nurses label Henrietta's drawn blood as colored. Because this was during the Jim Crow era, the controversy raised a lot of eyebrows. Henrietta's doctor at the time, Howard Jones, states she received the same exact treatment patient Kelly, patient Karen, or the next white generic sounding named patient would get. If that's the case, then why have many studies shown that colored patients were barely hospitalized? As I was saying, why were colored patients barely hospitalized and cared for during later stages of their diseases than white patients? Why were colored patients given less pain medication? And why on earth were their mortality rates higher than white patients? Lacks' story is one of the many others that have ended in a terrible fate. However, one truly disturbing and controversial story in the history of medicine is the Tuskegee experiment. The purpose of this quote-unquote experiment was to observe how the untreated sexually transmitted disease, syphilis, developed in African American men in Alabama. These men were then granted free medical care and other valuable things for being involved in this study. Nearly 400 men had already contracted the disease even before the experiment happened. However, not a single man was aware that he was already infected. The men didn't even receive penicillin for treatment, even though it was already proven to help cure syphilis. This ended with the death of the 400 men, a death that was entirely preventable, but still succumbed to, all because they were denied of receiving the treatment they were promised. Opposing sides may say that this experiment wasn't personally targeting black people and purposely killing them. And honestly, I'm not sure why anyone would say that, but if that's that, then why were they not informed of their disease or given the treatment that was necessary and was already available to them? Now, I don't want to get political and all, but if I had to, do you think that sweet white boy Jimmy would receive the same treatment for his syphilis like how those 400 black men did? I'm gonna let you guys answer that. I'm gonna let you guys think about that. And once you do, just, I don't know, keep watching the video. Now in the 21st century, the medical community has definitely learned from their terrible past mistakes and now uphold higher and better morals, learning to save lives rather than watching them die.